Welcome.
Hi guys.
Happy New Year from Havana Plastic Surgery. Today we are diving right into the world of gastric sleeve procedures with Dr. Moradian. Thank you for being here.
Thank you for having me.
All right, so whether you're considering the procedure or you're just curious about the process, this live is for you. Ready?
Yep, I'm ready.
All right, so these are questions that we received from some of our patients about this procedure.
Okay.
What does the gastric sleeve procedure involve and how is it performed?
So gastric sleeve is one of the procedures I do in addition to the cosmetic surgery. And a sleeve basically is removing about 80% of the stomach to help patients achieve weight loss, but also help if you have hypertension, high cholesterol, sleep apnea. It helps resolve those where you're not taking any medications, you're off your CPAP. A lot of benefits to the surgery.
Oh, that's good. I don't know.
Yeah.
How do you determine if a patient is a suitable candidate for gastric sleeve surgery?
So a suitable candidate is someone that comes in for a consult, or we have a virtual consult. Usually it's a patient who struggled with weight loss. Sometimes now it's patients that have tried the medications out there, and once they're off the medications, they have the weight gain right back up. They're tired of being on those type of medications for weight loss, and they're ready to do weight loss surgery, such as a sleeve. Usually it's patients with a BMI, usually over 35. It can be over 30, a BMI, which is how we kind of measure the patient's body weight to see if they're a candidate for sleeves. If it's over 30, usually you have other medical conditions such as diabetes, hypertension, or high cholesterol.
Do you consider this being the safest and healthiest way to lose weight?
I do. In my opinion, by far it is. I think that a bypass is a great operation, maybe in patients with BMI over 50, but a sleeve nowadays is shown to be just as good in terms of weight loss, if not better, and also less complication profile. With the medications out there like Mounjaro, semaglutides, Ozempic, those medications, we don't have good long-term data. They do help lose weight, but we don't have very good long-term data how this interacts with patients and their lifestyle, what factors it may bring up later on in life. So that's why I have a tough time recommending those for patients.
And those injections are also used to treat other type of conditions.
Correct. Yes.
Yeah. All right. Next question. What are the typical weight loss expectations for patients undergoing gastric sleeve surgery?
So it really depends on how much the patient weighs. Usually typical weight loss is anywhere from 50 to 150 plus pounds. It just kind of depends, how big the patient is, how much weight they want to lose, and that kind of determines the weight loss from there.
Awesome. Can you walk us through the recovery process after this procedure?
Sure. The recovery process is basically, you wake up, I do these at a hospital. Patients usually stay 24 hours. Most common complaint after a gastric sleeve is gas pain because of how the procedures performed. But usually that's resolved, walking around. You go home the next day, and recovery is pretty smooth from that standpoint. Then we start talking about the diet, which we'll talk about later, I guess.
That's actually the next question.
Okay.
What dietary changes are required before and after the surgery, and how do they contribute to the success?
So dietary changes are paramount in the success of a gastric sleeve. Any weight loss surgery or even medications, you have to adhere to a strict diet. So my diet, I usually do 2 weeks of liquids before surgery, which helps shrink fat around the stomach, also decrease the size of the liver. Because a lot of patients with obesity suffer from what we call non-alcoholic steatohepatitis, which basically is a fancy way of saying fatty liver. So this 2-week diet, liquids help shrink the liver, makes the operation safer to perform. And then after surgery, you're on another 2 weeks of just liquid diet. It also helps essentially the stomach heal safely, heal better without the insult of food yet.
How long is the surgery?
Surgery takes about 45 minutes to an hour.
Oh, that's quick.
Yeah.
What are the potential risks and complications associated with gastric sleeve surgery?
That's a good question. So sleeve surgery, basically the biggest risk we worry about, potentially most common, is bleeding. Bleeding happens, we control it. Really the big thing we worry about is a leak after a surgery. What does that mean? When I remove the stomach, we staple around the outside portion of the stomach, and a leak can occur usually within the first week. 7 days is when the most common leaks occur. And if those happen, we have to put drains in and take care of it. But a gastric leak is probably the most feared complication with surgeons who perform this surgery. We also worry about blood clots, which is common to any surgery. Really, bleeding and blood clots are the most common with any surgery really performed. And for blood clots, I give a blood thinner before surgery, and after surgery, you're walking immediately to help, compound that, avoid that issue.
Interesting.
Mm-hmm.
How can patients maintain their weight loss in the long term after gastric sleeve surgery?
So maintaining it is about the strict diet adherence we talked about earlier. Very important to follow the diet. We have a diet plan here that I give you that's personalized to you. And sometimes there's always hiccups along the path. This is a marathon, not a sprint. So weight loss surgery is pretty quick procedure, but the benefits are lifelong. And to enjoy those benefits, you have to follow the diet and always eat smaller proportions, which are usually around the 4 to 6 ounce range. And you start getting on solid normal food around the 4 to 5 week mark. But that's where we kind of go over everything personalized with the diet after surgery when you come in for a consult as well as post-op.
You have to trust the process.
Exactly.
How does the gastric sleeve surgery affect obesity-related medical conditions such as diabetes or hypertension?
So kind of touched on it earlier. Basically, it helps resolve those issues. Patients with diabetes, hypertension, high cholesterol, sleep apnea, osteoarthritis, all, if not really most of my patients stop taking those medications because after the weight loss is achieved, those diseases essentially go away and those are resolved. So it's a one-stop shop to help avoid those complications. If you're living with chronic diabetes, hypertension, a sleeve, if you're overweight, can help alleviate those.
So what if someone doesn't want to do the surgery to lose weight and you want to just come
for diabetes or something?
Right.
Well, you have to be overweight. That's the kicker. So
okay.
That's usually those go hand in hand. 40% of the population is technically obese. So there's a big demand out there for it.
Okay. How quick after surgery can patients start seeing themselves slimmer?
Usually, you'll lose at least 10 to 15 pounds within the first 2 weeks. And then after that, you get ready to lose weight because you can lose weight, in a month up to 30 pounds, 2 months, 30 to 50 pounds. Every patient's kind of different. It just depends, again, the size of the patient before surgery to expect how much to lose after.
Okay, how does a gastric sleeve surgery necessitate changes in lifestyle, including exercise?
So it's always important to, adhere to a diet, which we already talked about, and then lifestyle. What does that mean? Lifestyle. So, going to the gym is always going to help. Even with my cosmetic surgery patients, I always recommend, if you can work out and help maintain the results, you're only going to get better with time. So same thing goes with weight loss surgery. If you're able to have somewhat active lifestyle, going to the gym, doing light cardio, or whatever cardio you're comfortable with, you're going to help enjoy a healthier lifestyle.
How soon after the surgery can they go to the gym?
So usually I recommend, going back to the gym at least 4 or 6 weeks, because it kind of depends if you had a hernia in the area. So at least, 6 weeks after surgery to get back in the heavy gym time.
Pretty quick.
Yeah.
All right. Last but not least, can you share some success stories of patients who have undergone gastric sleeve surgery in your practice?
Success stories. Well, there's many of success stories that I've had over the years, but really in particular, I remember a patient basically struggling with diabetes, was on 3 or 4 different medications, was overweight, also had, depression symptoms and was on depression medications. And after the weight loss, it was kind of like just a click. The patient kind of lost weight, diabetes medications slowly tapered where she wasn't taking anymore, and depression was resolved. She was happier and is doing very well to this day.
I love to hear that.
Yeah.
That's amazing.
Mm-hmm.
Well, you guys heard it here first. Everything you need to know about gastric sleeve procedures. Thank you so much for watching this live. And well, stay tuned for the next live with Dr. Moradian.